Well, I want to bring in Dr. Stephen Brierre. He's an associate professor of clinical medicine at Louisiana State University's Health Sciences Center. Dr. Brierre, thank you so much for joining us. The coronavirus has created a challenge for many medical staffs to prepare for Hurricane Ida. What is your biggest concern as this storm hits?
Thank you for having me here today. My biggest concern is probably the lower lying hospitals south of us that might have issues with power and how we will take care of patients from them if they require evacuations in the coming 24 to 72 hours.
So I want to ask you a bit more about that because more than 500,000 homes and businesses have lost electricity. It's my understanding that a lot of hospitals do have generators, but losing power is still a concern?
Losing power does remain a concern. Generators are present for hospitals. They're dedicated to special areas of the hospital, but generators can fail. We've seen this previously in storms. And so we develop contingency plans to deal with those failures and to make sure we accommodate all the people of the state who need care.
Well, many medical centers are filled with COVID patients. What have officials done to make more room and increase hospital capacity?
Yeah, the same thing we do for all contingency plans. So although our ICUs have been full for some time due to the recent surge in COVID cases in Louisiana, we just changed nursing staffing ratios. We reappropriate nurses to different service lines based on the needs. And you just develop alternative standards of care to ensure that we are providing care to everybody who needs it.
You mentioned staffing. You know, I remember a few weeks ago listening to a briefing by the governor of Louisiana who talked about shortages specifically of nursing staff and personnel. What has that been like, contending with that situation as you are dealing with a hurricane that is bearing down on you?
The nursing shortages and respiratory therapist shortages throughout the hospital, to be honest with you, have been difficult. Our core nurses that we currently employ have been working very hard and doing a ton of overtime and extra shifts. We've brought in contract nurses to help fill in some gaps. And then the state is now working with us to provide other nurses so that we can maintain surge capacities for a longer period of time. We've also adjusted what the nursing staffing ratios are and triage patients a little differently so that maybe one ICU nurse can take care of 3 and sometimes even 4 in extreme situation patients.
Well, we know that cities like New Orleans have suspended emergency medical services. What would you say to residents who may be in need of help?
Yeah, it's a difficult situation. You know, EMS suspends their driving when winds are too high. Hospitals, when they suspend emergency services, aren't really suspending emergency services. If a person shows up at our doorstep, we'll always take care of them. What you're trying to do is just limit the routine stuff that comes in your ER that doesn't really need care at that exact moment. So, you know, minor traumas and things like that, or people presenting with eye pain, we try and discourage those things from coming to the hospital, you know, and only use the emergency room for what it really is designed for, which is true emergencies, especially during these times.
Before we let you go, Doctor, I wonder if I could just get your sort of personal thought here on the idea of just you and your fellow medical personnel. How long have you been going here? I imagine preparations for this have probably been going on for days.
Regarding this hurricane or the surge? Regarding the surge, I mean, in Louisiana, we've had 4 over a period of 18 months. For the hurricane, we had pretty good line of sight that this was going to impact Louisiana very early last week, and so preparations began then to develop contingency plans to make sure we serve our community.
All right, Dr. Stephen Brierre. Doctor, thank you so much for taking the time to talk to us.
Thank you. Stay safe.